Hello, everybody, and welcome to the Botanical Biohacking Podcast. Today, we are joined by two very regal and elegant guests, Chris Volesky and Stacey Donelson. Welcome.
Thank you.
Thank you.
Today, we're going to be speaking about autoimmune disorders, and this is an area that Chris is very well known for. So, Chris, could you tell us a little bit about how you got started in treating autoimmune disorders and why you chose to treat something that is, quote, incurable?
In all honesty, it began as an intellectual challenge. It's a lot more complicated than looking at something like, a simple musculoskeletal disorder. We're dealing with multiple things simultaneously, a chronic disease, digestive issues, emotional component, of course, mixed in with that. And there's not a lot of good options for these people. It's basically, here you go, you're on drugs for life, on and off things like prednisone, which of course kill your immune system. You're going to be getting sick over and over again. Horrible dietary restrictions oftentimes. And it's a population that I enjoy helping and find stimulating to treat.
Now, if you're using herbs which are boosting the immune system, aren't you in fact killing them?
It's a good question, actually. There's an almost paradoxical action that occurs when using some of the herbs that work effectively for this kind of thing. There are immunoregulatory effects of a lot of these herbs that tend to take the immune system in a direction that it actually needs to go. We combine this kind of thing with herbs that are known to have specific effects on, decreasing pro-inflammatory cytokines, interleukins, tumor necrosis factors, things of that nature. And using modern research, we can actually look at specific herbs that will actually affect certain antibodies. For example, looking at people with Hashimoto's thyroiditis, we've looked at quite a bit in our clinic, and there's herbs that actually lower the antibody count.
Now, how does it do this? Because generally speaking, you're either depressing or increasing the immune system, but it sounds like you're looking at perhaps balancing it at kind of deeper level than they may be able to experience if they were just working with a rheumatologist.
It becomes a little bit more complex than just saying, hey, we're going to downregulate one specific immune factor. Some of the herbs that we're using commonly have effects on entire aspects of the body and of the endocrine system. For example, we use a formula that has a regulatory effect on the hypothalamic pituitary axis. So this has a regulatory effect on endogenous production of things like corticosteroids. It helps in balancing endogenous hormones, sex hormones, that kind of thing. And then we will combine this with things that will help reduce the inflammation and then target very specific things such as thyroid antibodies.
So when you're talking about working with the hormones, is that kind of like using a steroidal anti-inflammatory?
In some cases, some herbs will have an effect similar to a steroid. Our ultimate goal, though, is to increase the body's own production of these kinds of things so that the body is actually taking care of itself in that respect. So that as you're treating this kind of thing, boosting the body's own endogenous production of this kind of thing, boosting, RNA production of things like proteins associated with steroids, it's actually improving the body's own ability to take care of itself in that regard.
Okay, so it's kind of like if I take anabolic steroids to have really sweet abs, it will drop my own testosterone that I'm making by myself. But if I'm working with my body to generally be healthier, then my body would naturally produce testosterone. And then if I was exercising, I'm not going to exercise, but if I was exercising, I could potentially get sweet abs. Is this something similar when it comes to the body's ability to relieve its own pain?
Yes, I think so. Exactly.
What role does acupuncture play in your practice? Are you mainly using herbs or acupuncture? When would you say one or the other is maybe more appropriate for those who suffer from autoimmune disorders, from Crohn's disease to rheumatoid arthritis?
Acupuncture's got an interesting role. It's we often use it as sort of an emergency medicine tactic because we can very quickly reduce somebody's pain. it's found to have regulatory effects on nitric oxide levels so that we can decrease pain, decrease inflammation, and it helps in getting that immediate relief that people are oftentimes looking for. The underlying strategy then is working with, of course, their diet, their lifestyle, and using plant-based medicines that are having regulatory effects on the body so that we are promoting decreases in inflammation, promoting endogenous increase of specific hormones, corticosteroids, things of that nature.
You mentioned nitric oxide. Could you explain a little bit about what that is and why that would matter when it comes to autoimmune disorders?
Well, you've covered this a little bit. Nitric oxide is it's a gaseous substance in the body that works as a cellular communicator. It's vital to cell production, to production or to mitochondrial activity, but in too high quantities, it's highly inflammatory. We see this in times of stress, for example, when people get angry and they start to get headaches behind their eyes. They get this accumulation of nitric oxide there that actually starts to damage the retina. In things like autoimmune disease, you get sort of areas of increased nitric oxide, so it starts promoting this inflammation. For example, in the joints of in rheumatoid arthritis.
What is with, people will get this kind of bilateral, or both hands will get really cold. What is going on with that? It seems like it defies logic or explanation. Maybe I just haven't cracked open the right book. What's going on with this, and why do you think it affects certain populations more than others, and why women more than men? Maybe nobody knows this. I've just been curious.
It's very interesting because it's very common in these autoimmune patients. When it's occurring with an autoimmune disease, it's known as Raynaud's phenomenon, and it's basically a spasming of the arterioles in the hands and feet. So now their hands and feet get extremely cold. They might turn white or purple. But when we look at it from the standpoint of something like nitric oxide, this communicator has the potential to either vasodilate or vasoconstrict. So getting these high concentrations in places like the small joints of the hand or the small vessels of the hand will actually constrict. So they're freezing cold and their joints are swollen and painful from the inflammation of the disease.
Do you think this also might explain why some people have burning hands or feet at night? So sometimes people will have really frigid areas of the body associated with diseases, and sometimes they'll have kind of burning pain associated with these various autoimmune diseases. Do you think that there's something correlated between these two?
Absolutely. Not only that, but when you've decreased circulation to an area like that, and you've got an inflammatory process occurring there, you're also decreasing lymphatic flow to the area, so the area will also become swollen.
What happens to the body when you're decreasing lymphatic flow? I hear about this, but on a practical basis, why does that matter? Does that only matter if you have a cold or something, or?
Essentially, the lymphatic system's job is to keep the system clean. So when you have an injury to an area, you have vessel dilation, you have cell permeability. These vessels will actually dilate and allow immune factors, mast cells burst, different factors that go to the area to help it heal. And if you decrease something like lymphatic flow, the area will swell, and now the extracellular debris, the sort of byproducts of the injury, are not allowed to be carried away. So it's extremely important because now that will actually decrease blood flow to the area, which will inhibit the body's ability to get the things there that need to be there in order for it to heal.
Okay, so it's like you're trying to do this construction project and clean up and repair tissue, but the roads are too filled with garbage to even get there. So without that getting cleaned out, you're not going to have very efficient tissue repair. Is that kind of the idea?
That's basically it. It's like the cleanup crew didn't do their job, so now the semis with the fresh material can't make their way in.
Can you tell us some stories about patients you've had and what their life was like before and during the treatment process with you, and then what their life was like after? Of course, avoiding personal names and this kind of thing.
Of course. Oftentimes it seems like a very daunting task when these people come in because they almost appear a mess. There's problems with their digestive system. They probably have, X number of pains. They've got fatigue, anxiety, depression. They probably don't sleep very well. And then, of course, they're going to start reporting seemingly strange things that you won't necessarily find in a textbook, like my skin feels very strange in this one area, or every time I think of puppies, my butt hurts, or they just come up with these very, very strange things that don't really seem to make any sense. So then people get very confused and oftentimes don't know what to do. So then, of course, we look on forums and people are asking, how do you treat rheumatoid arthritis? How do you treat Crohn's disease? Because they're completely lost. They have no clue what to do with them. And of course, the patients are suffering. So you're looking at this person in front of you saying, now what do I do? In our practice, this is where diagnosis has become so pivotal. We use, pulse diagnosis, very in-depth tongue diagnosis, sublingual diagnosis, these kinds of things, to basically piece together what's the right plan of action. How do we start with this person? Well, let me give you an example of a patient that came in a while back. Really, really lovely woman. A very typical story. She run the gauntlet of what traditional medicine has to offer. Anything from different drugs, other alternative therapies, things along the lines of physical therapy for the pain. She's tried a number of different dietary practices, and of course, major dietary restriction, which just begins to make you cranky. People call this orthorexia, where you're basically obsessing over your food to the point where it's creating a deleterious effect on your life. But this lady came in and had been diagnosed with multiple autoimmune diseases. We're looking at things like Sjogren's disease, rheumatoid arthritis. She'd also been diagnosed with Ehlers-Danlos, so she's ending up with joint dislocation. She could be out walking and her kneecap would just suddenly displace from this condition.
What did that do to her quality of life? Because if she has to have this outrageous diet, she can't walk without her knee breaking down. I would guess she's not the best hiking partner.
Well, the overwhelming emotion that starts to surface is actually fear. Because they become afraid that everything they do is going to harm them. Or they're afraid to go somewhere for fear of, an attack of the condition, an increase in pain, maybe a migraine or something along those lines. Or they're afraid to go to a restaurant because they might use such and such ingredients that will actually
like a nightshade
lead to a
or
flare.
something.
Exactly.
Yeah.
So the quality of life becomes horrible. They start to almost develop an agoraphobia. They're afraid to leave the house. They're afraid to have somebody else prepare food. They become less social because they don't want to be around family and show suffering, show pain, that kind of thing.
That's pretty much, it describes somebody's life in a prison or on house arrest. To have somebody who's done nothing wrong to be kind of sentenced to this sort of lifestyle and then not to see a way out. Because when you're talking about Sjogren's and RA, most doctors will say there's only so much that can be done in the whole wide world, because that's what I remember from medical school in the 80s, and you're doomed.
Yeah. And that becomes their overwhelming thought. Of course, if they're told by their doctor, then they think, now there's just no way out. This is my fate. Woe is me. I'll just go eat some worms.
So what was your assessment of her diagnosis? Did you find that maybe something was missing in the approach people had taken? And can you describe that a little bit for us?
It in some ways was oddly simple. First and foremost, we work with the diet, proper dietary practices, and it oftentimes is as simple as looking at, okay, are we eating whole foods? Are we seasoning our foods with things that promote digestion? I mean, this can be as simple as adding cinnamon and nutmeg and ginger to your food, because these things have an anti-inflammatory effect on the gut. They help you digest your food. They help your body in releasing proper digestive enzymes.
Well, wait, wasn't she already on a perfect diet? Because she had seen a nutritionist. So, if she was already really obsessive with her diet, what was there for you to improve?
I think that's the first key, is to get them to not obsess over it, to realize that everything isn't going to hurt them. We look at making sure that they're eating quality, that they're getting whole foods. And actually, anywhere I can, I will actually try to widen out the diet, add new things in. Because then they have a little bit more liberty when they are out with friends, are out doing something.
So what was your first recommendation for her, keeping in mind this isn't a recommendation that you may give to everybody with an autoimmune disorder?
We basically laid out a little plan for her and said, okay, we're going to do some acupuncture to start bringing your pain down right away, to get you sleeping better.
Mm-hmm.
And then we laid out a course of herbal treatment to start decreasing the inflammatory process, to smooth out the distribution of nitric oxide, especially at the liver, to decrease inflammation at the liver, to decrease liver enzyme function. This is very common in people with these conditions because they're taking usually a handful of meds and probably things like Tylenol, Excedrin, things along these lines, which have a very toxic effect on the liver, and they're taking them on a daily basis.
Okay, so what was her experience with this treatment, and how soon did her quality of life begin to change?
The benefit was that it happened almost immediately. She started noticing immediately lower pain levels, days of less pain, and then I can always tell when they walk in because I just look at their face.
Mm-hmm.
I can see the life come back. You see a smile on their
Mm-hmm.
face. You see less fear. Or they tell you, my husband noticed that I was happier. My
Mm-hmm.
coworkers are noticing the difference in my mood. To me, this is always an enormous sign because oftentimes people will beat themselves up inside, or they'll nitpick, a minor pain, for example, and say like, oh, well, I'm not cured.
Mm-hmm.
But then they have their loved ones, their coworkers, those surrounding them saying like, wow, you seem so different.
Mm-hmm.
And it's very reassuring both to them and to me in the treatment process to know that, okay, look, this is not in your head. Other people see you. Other people see you're doing better. They see the contributions you're making,
Mm-hmm.
the way that it's changing you, the way that your quality of life has improved.
Excellent. And so her pain went down, and then did her labs begin to change as well?
Yes, lab values improved, pain levels went down. She noted she slept better, had better energy levels, mood improved.
Mm-hmm.
That's always a big thing. Mood can tell you a lot. People can come at you and say, my life sucks, I'm afraid, all this kind of thing. I have all these pains, and they can come at you and say like, well, I have a little bit of pain, but they're smiling, they're happy. So you can tell that it's really not something that's bothering them as much.
Mm-hmm.
And as you progress through the treatment course, you see the pain levels decrease further, their energy, their vibrancy, their vitality
Mm-hmm.
increase even further, and it becomes a very interesting sight to see, especially when they look back and think, wow, how hopeless was I 3 months ago, 4 months ago?
Oh, must be very rewarding as a practitioner to see those kind of results with diseases which are often thought to be very hopeless. What about Crohn's disease? Because this affects a lot of people. It's not something people tend to talk about, like, hey, everybody, I'm about to shit my pants. But that's oftentimes the fear which many people with Crohn's disease have going out in public and this kind of thing. What has been your experience treating these people?
I think you captioned it very well, just saying the amount of fear that they have, because these people will walk around, they might run to the bathroom, and I mean run to the bathroom
Mm-hmm.
20 times a day.
Mm-hmm.
And this can be extraordinarily embarrassing. It can mean having to do more laundry because they didn't make it to the bathroom in time. I've literally had people that couldn't make it 12 steps from their bed to the bathroom without soiling themselves. So this has an enormous effect on their demeanor, their confidence, their quality of life is, of course, terrible because half the time they're wearing diapers.
How do you feel sexy with that?
Exactly. Their relationships suffer if they have a relationship at all.
Mm-hmm.
Half the time they won't put themselves out there because of the fear of the situation. They don't want to be judged. They don't want to embarrass themselves.
Mm-hmm. Yeah, I think that would be kind of a potential deal breaker, right? Like, hey, do you want to come over to my house tonight? You know what? I didn't get the right kind of sheets to deal with your situation. Nope.
Yeah. And that calls to mind one of the basic things that we look for in life, and that's connection with others.
Mm-hmm.
And if we have a disease that's inhibiting our ability to connect with others, our quality of life just steadily declines.
What kind of results have you seen clinically with Crohn's disease, and what's the typical timeline, if there is one, for people who are suffering from Crohn's disease to see an improvement in life quality?
I've been oddly impressed with the speed and the success that I've seen with things like Crohn's disease and ulcerative colitis, or microscopic colitis was another one that we see. Very frequently, they come, they're going to the bathroom very frequently, they have intense abdominal pains. Sometimes they've had part of their intestines removed, which may seem like a very bleak outlook from a treatment standpoint. But I oftentimes will see the pain decrease almost immediately. Oftentimes within a week or two, they'll report little to no intestinal pain. By the time you get to 2 to 3 months in, they might be going to the bathroom 2 to 3 times a day. They might still have diarrhea,
right?
With 1 or 2 of those times. But, imagine doing that twice a day as opposed to 20.
Right.
You have a much lower toilet paper bill, which is great for people.
Definitely. And it's interesting because the gut microbiota can begin to change within 2 to 3 days. But it looks like even more than that, you're causing a steady improvement over a 3-month period. Can you describe a little bit about what their experience is like? So the pain goes down right away, and then is it just a gradual, steady decreasing of trips to the bathroom, or does it kind of zig and zag as it goes down?
You can have exacerbations here and there, and a lot of it depends on how the patient is doing. Stressors in their life can affect this kind of thing as well. But the overall goal is so that you make it so that these stressors don't cause these problems. I had one lady that came in and said, I just want to be able to eat a chocolate chip cookie without having to run to the bathroom for the next 24 hours. That was a big thing for her. That's a basic quality of life thing. Imagine Christmas time. You've got people coming into work, bringing in treats and whatnot. And at the end of 4 months, she told me this, and she said, I had a chocolate chip cookie. I didn't have diarrhea. It was great. She was so happy about this. Just a simple thing that so many of us will take for granted, of eating a cookie.
That's interesting. Have you noticed any correlation between certain types of people and ulcerative colitis or Crohn's? For a while, I was getting all of these construction workers in Oregon who didn't know each other. But in the process of digging, they were kicking up different microbes. I don't know, but they were all presenting with really similar syndrome. Have you seen any kind of connection between people within a certain demographic who may be picking up something nasty, or is it more a case of lifestyle factors and stress contributing to sort of a downward spiral that results in Crohn's or ulcerative colitis?
In the history of looking at what's going on with them, there's almost always some event. Like, I got sick, I had food poisoning, something served as a catalyst for the whole process for them. But then they'll talk about this event that occurred, and then they had some maybe lingering symptoms that seem to get worse and worse, and then lifestyle factors become a big issue. It's not so much that it was, I've never been able to eat a cookie, or I've never been able to eat pasta, for example. But as their gut deteriorates, the microbiome gets thrown off, these things become much, much harder for them to digest, and the body starts seeing seemingly normal foods as significant irritants to them.
Interesting. What about you, Stacey? Have you seen the same kind of thing, or?
Chris and I were talking about this earlier this morning. I definitely have a personality type and like a type that tends to fit these situations, and it tends to be males who are engineers, whether they're software engineers, chemical engineers, mechanical engineers. They're very smart, they're in their heads a lot, tend to be very stoic, don't tend to show a lot of emotion, and don't move a whole lot. And they can be in great shape, but they have this digestive system that is totally not functioning well.
Do they eat a lot of street meat? What's the deal? Why would this have any connection?
I think they're sitting at their computers and they're, either coding or, doing their engineering work. It's an incredibly stressful situation. They tend to have incredible high levels of stress, and they don't have great outlets to relieve that stress. And then they're eating at their desk. So, they may get up and have a salad or eat street meat or Big Mac or something like that, but they're not moving. And they're sitting there in this incredibly stressed situation, and the result is IBS or Crohn's or...
Are you implying that moving is important for digestion?
Yes. Yes, exercise and movement is important for the well-being of the entire human body.
But what if they just go to 24-hour fitness later and they crank out some reps and they do this kind of, minimalist Tim Ferriss style workout at 2 a.m. They do their, deadlifts and then go home. Surely that's going to be enough.
It depends on the person. Some people that might be enough or enough for a while. But I find it's more, again, getting back to what Chris was talking about, that quality of life. So it's, if you're sitting at your computer programming 10 hours a day, eating street meat and barely walking, not only are you not exercising, but you're not connecting with your loved ones and your friends, and you're not actually really enjoying life much.
What about telling people on the internet that they're wrong? Doesn't this provide some sort of community for them?
It's definitely an outlet. I think you can definitely maybe make a correlation between internet trolls and unhappy people, but it's not the kind of connection and quality of life that I would recommend.
I think it's an important thing to point out, and something I talk to my patients about frequently. They sit at a desk all day. Of course, that means that they're not moving. This is not good for digestion, circulation, and all this. But then they deal with stressful events while seated, without moving. And now they've got stress hormones coursing through their system, cortisol, adrenaline, norepinephrine, that are telling their body to run like hell, to fight, or to lock up. And if you're just sitting there, these hormones will wreak havoc on the body. I mean, how many times have you heard somebody say, my stress is in my shoulders? Or they get up and they're stiff. They can barely move their legs. I see a lot of people with arthritic conditions, and once you get rid of the arthritic pain, they'll still complain of tightness in the legs. But then they'll talk about how stressful their week was, and they sat for 50 hours at a desk.
That's interesting. So with the fight and flight response, we either want to start climbing our way up a tree, clawing something's eyes out, or running away, but we're probably not allowed to do that in an office setting. So what happens to those urges? What happens to those hormones? And how would that affect pain signaling in cases of ulcerative colitis or rheumatoid arthritis?
It actually is surprisingly basic. You have these hormones whose job it is to basically upregulate your system so that you are now geared for a fight. You're able to run faster, this kind of thing. It increases endogenous production of nitric oxide, which will increase mitochondrial production. So now you've got these hormones coursing through your system that's job it is to get your muscles moving more, to get your heart rate up, and you're not going anywhere. So now the muscles themselves are actually seizing up and contracting like they were supposed to be from fleeing or fighting, basically. So now people say like, oh, my neck is always so stiff. I always get these headaches, always at work and whatnot.
Excellent.
I also talk about, like, if you're in fight, flight, or freeze, one of the things the vagus nerve does is shut down digestion. Like, you're not going to be sitting there digesting your meal if you're trying to run from a bear. And so you're now sitting with the IBS and ulcerative colitis people where their state of stress is actually compounding and in many ways creating their problem because they're not digesting their food, or the other result of fight or flight is you literally shit yourself. Like, you get rid of everything so that you can run.
So lighten the load.
And here you are in this day and age in a culture where you're sitting at your desk having these stress hormones flow through. And as Chris just so elegantly described, you can't do anything about it. And over time, you have these digestive issues to develop.
And I think that brings up a very good point, especially in these autoimmune conditions where we've already got a gut that is compromised. Maybe there's lesions in the gut, these kinds of things. And now we've decreased our production of enzymes that are meant to break these things down prior to allowing them into the bloodstream. So now things actually might get through the gut that weren't supposed to. The immune system no longer recognizes that as a substance that it can use, and now your immune system goes on high alert. This is one of the fundamental things that we look at in dealing with any autoimmune disease. How is the gut working? Because a healthy gut is essential to helping fix these autoimmune conditions.
Awesome. So for people who have autoimmune disorders, what is one piece of advice that you could leave them with? So anyone listening to this, if you have an autoimmune disorder or know somebody who does, what is one safe piece of advice that everybody could follow that may improve their quality of lives?
Do I really only get one?
1 to 3.
1 to 3, I would say move more, eat real food, nothing in a package, and spend more time in enjoyment with friends and family.
How about you, Stacey?
The only thing I would add to that is maybe get a good over-the-counter probiotic.
How do you know if something's good? Because they all claim to be the best and everything else is garbage and only theirs goes through the gut lining. I'm confused. They're all expensive. Help me out here.
Honestly, I think if you buy one that's in the refrigerated section and you can afford it, you're doing better than nothing.
Sounds good. My approach is usually to lick doorknobs to introduce, but I don't know if that's the best policy. I've just been taking it.
Or eat dirt.
Yeah, or to eat dirt, which, yeah.
So I was just sharing with Chris and Andrew that I had a patient who had chronic colon spasming and incredible pain, and usually would follow by diarrhea between 5 to 10 times a day. Lovely woman. Very, she was in the top of her field, was going places, but she had this challenge and had been to everybody, just like Chris's example, and was fearful about performing in work. She wanted to get pregnant and have kids and was worried about how that would work. So she came to me and we're doing all the protocols that Chris was talking about, diet and herbs and acupuncture. And at one point we were talking and I asked her she was in a very calm meditative state on the table during an acupuncture session. I asked her to remember the first time she remembered experiencing this event. And she remembered when she was 9 and she had to do a presentation at school, and the stress about presenting this thing that she had been working on and not having it be perfect enough basically created this first instance of such severe abdominal cramping that she didn't go to school. And after that, and that was a really key thing for her to realize, was that this fear of this judgment and from her outside peers would create this fear response in her that would literally send her into extreme abdominal pain. And we just did a simple meditation where she went back to that age of 9, saw herself and kind of just gave herself some loving kindness, and was able to she had a major emotional release on the table, which translates to a lot of crying, and felt immediately better and resolved. And from then on, every time she had to do a presentation, every time something that was coming up that she knew would trigger that emotional response, she would just talk nicely to herself. And I went from seeing her weekly and her having, maybe 5 to 10 episodes a day. I haven't seen her in 3 months. She's fabulous. And a side effect of that was that her severe menstrual cramps also disappeared. And all of a sudden, the idea of her being able to have kids and have a pregnancy and have an easy pregnancy, it's a possibility, whereas before she was scared.
Sounds to me like witchcraft.
Possibly.
Didn't you have some research talking about the effects of releasing stress hormones when people cry and the benefit of crying itself as a therapy?
Well, they found trace amounts of cortisol in tears. So if it's coming out by way of tears, it's not floating around in your blood screaming at you.
Fascinating.
Which is also why if I want that morning get up and go, I have a jar of the tears of my enemies, and I just drink that to give me that cortisol boost to get up and do my push-ups and take that morning walk.
Right. Well, I think I often quote Harvard has some research about meditation, and especially mindful meditation of loving kindness and how it reduces inflammatory processes. It releases oxytocin, which is one of the most potent drugs in the human body. It's actually an incredible, powerful healing drug, does all sorts of anti-inflammatory actions. And so honestly, just thinking nice things about yourself makes you feel good and heals you.
Is that because of the hippie witchcraft effect on the endocrine system and hormones?
Definitely.
Okay.
And for those of you listening, we will be selling the tears of your enemies at a local gym near you.
Excellent. So how can people find you guys online or otherwise? So if they're dealing with autoimmune disorders, pain of this sort of thing, what's the contact point? Or do you want people contacting you anymore? Or you're kind of one of those recluses, like the guy who wrote The Catcher in the Rye? That one?
J.D. Salinger.
Yeah, he doesn't want anybody to talk. I suspect it may be like this. So if you want to deal with people, how would those people find you?
I'm located in Longmont. You can find me at Good Life Acupuncture and Wellness or www.goodlifelongmont.com.
We're located in Denver. Best way is to look at our website. It's vitalitycenter.com.
So if you're flying in for treatment, you can also smoke all the weed you want because it's Colorado. I don't know if this is indicated for your condition, but, well, I'm not telling you should, but 2 birds, 1 stone. You know what I mean? Well, thank you very much for listening to the Botanical Biohacking Podcast. We love you very much, platonically. And if you would write us fan mail, I would appreciate that, but nothing creepy. Thank you very much. God bless.